Hi there, I'm Dr. Mahesh Mohan and I'm welcoming you all to the educational video. And today it will be about 5 tips for managing a pain management injection or typical epidural shot that you get at a pain medicine clinic. Again, a word of caution, this is only an educational video. Please follow the advice of your pain doctor or your primary doctor. This one is purely for educational purpose. And today we are trying to cover mostly injections such as epidural injection or facet injection or radiofrequency ablation. And most of them are, or some of them are done with sedation. So coming to the tips, the first tip is about blood thinners. So if you take any blood thinner, make sure you talk to a pain doctor, make a plan and come off the blood thinner if you can, if it is advised by a pain doctor. So it lessens the chance of bleeding, infection or weakness such as complications coming out of this procedure. So typically if you take aspirin and if you are able to come off the aspirin for about 6 days, and that would mitigate the effect of the aspirin. And if you take coumarin, come off it for about 5 days and do a PT-INR on the day of the procedure before the procedure is done. So that would be my first tip. The second one would be about sedation and fasting. So some of these procedures are done with sedation, and it's important that you fast for at least 6 hours before the procedure is done. You could take sips of water up until maybe an hour before the procedure, but this could be a big difference between you throwing up and aspirating and having a simple procedure. So that's the second tip. And the third one would be about driving back home or getting a ride back home. So make sure you plan the day well. Make sure you have a driver, especially if you're getting sedation or if you're getting any injections to the lower spine or nerve block for the lower extremity. And the fourth tip would be about contrast allergy. So some of these injections are done with contrast, ISOView or Omnipaque or even MRI contrast to enhance the visualization of the injection, the needle placement. So it's very important that you discuss your allergies with your pain doctor so they can make alternative plans to do the injection safely. So that covers the fourth tip. And the fifth one would be about the effect of the sedation. So make sure you understand that you may be having an impaired decision making or ability to use machinery or driving after sedation for several hours. So don't do it until you are clear to do so by your pain doctor. The last tip or a bonus tip would be, wear a loose fitting cloth. That would make the injection day much more affordable. So yeah, there it is. Those are the 5 tips for pain management procedures. Hope you have a nice day.